Hello everyone, welcome to Mantram Nursing Academy. Myself, it's Praveen P speaking, and I am here to discuss with you all about the upcoming Staff Nurse Recruitment exams of AIIMS Bathinda, and which is on 29th of September 2019. And today we will discuss about the tips and tricks for the exams, how you can score more, and what are the important topics to be discussed. Okay. So, as you all know, PG is conducting the exam for Bathinda, and it has been conducting exams throughout the year for various posts. I have been teaching for the past 5 to 6 years, and I have collected data from previous year's exams and tried to understand the favorite topics that have been asked frequently in exams. So, firstly, let us discuss about the exams. The paper will be carrying for 100 questions, that will be of 100 marks, and the duration of the exams is wind up for 100 minutes. So you will be having 1 minute for each questions. So there is also negative markings for each wrong answers. They will deduct 0.25 marks. Okay, and the exam will be like pen and paper mode, and you have to answer each OMR in answers in OMR sheets. So manage your time accordingly. So you'll get 1 minute for each questions. So let's through this syllabuses. Okay, already we have prioritizing for medical, surgical, and nursing, especially through anatomy and physiology, fundamentals of nursing, and midwifery and gynecology nursing, community of nursing, pediatrics, then psychiatry, pharmacology, and pathology, microbiology, and nursing research. Along with that, there included nursing education and nursing administrations. Okay, fine. We can just look at the weightages of each subjects with marks allocations. Okay, so we can first discuss about this medical, surgical nursing. Okay, in that we know that there are lots of systems, something like central nervous system, a respiratory system, renal and urinary system, endocrine system, musculoskeletal system, and including all the systems are anatomy and physiology with all the dimensions like structures, weightages, and their length and breadth, and its locations, anatomical locations. Even they are located at all these points. Along with that, each system is having disease conditions which covers of specific signs and symptoms, and some of them nursing cares. Okay, mainly they will ask regarding nursing care. So it is about 16 to 25% we are expected to ask questions from this portion. And along with that, interventory system, anesthesia, and stages of death and dying, completely regarding geriatrics and their growth and development. So this is also the part of medical surgical nursing, and here they may be asking 5 to 10% of questions. Okay, and next we can see fundamentals of nursing. As we know, the fundamentals of nursing is a vast topic and is a vast subject, and every questions aspects will be based on medical surgical aspected fundamentals, or fundamental aspected medical surgical questions will be asked in the form of verse wise. Okay, so we know that there are lots of important points like topics, code of ethics, nursing processes, vital signs, the therapeutic positions, specimen collections, and hot and cold applications, sutures, triage and grieving processes. So all these together they may ask 8 to 10% of questions. And moreover, fluid, electrolyte, and acid-base imbalances, basic life support, advanced cardiac life supports, for especially for adults and infants. They will comparatively asked, and liver function test, renal function test, pulmonary function test, endocrine functions, cardiac markers, urine analysis, hemoglobin and immunoglobulins, and cerebrospinal fluids, and arterial ABGs. So ABG values is always they will ask questions from ABG, especially respiratory acidosis, metabolic acidosis, and worse alkalosis. Okay, like see blood sugar, coagulation studies, even all these things they will ask, supposed to ask 8 to 10% of questions. Okay, next we can say about community. Community, as we know that it is also a vast subject, and moreover, health. Regarding health, we know that there are health concepts and health dimensions, health determinants and indicators of health, and levels of health care and its prevalence and prevention. In incident prevention, we know that primary prevention, secondary prevention, tertiary prevention, and one more thing is primordial prevention. Okay, fine. So they may going to ask the examples of each levels of prevention and how you are differentiating it. So the question we can expect from the differentiation of each preventive levels. Okay, then incidence rate, prevalence rate, epidemiology, we know that there are definitely they are going to ask questions from this epidemiology. And then national immunization schedules for these pediatrics and even for the adults as well, and communicable and non-communicable diseases and its signs and symptoms, everything will be thoroughly read. Okay, fine. And then hospital waste management, coming to segregation and waste disposal, and even we know that the color coding, everything comes under this hospital waste management. And then health policy planning commissions, as you all we know that. So they are going to ask around 7 to 9% of questions will be from these portions. Okay, fine. Next one is we know that midwifery and gynecological nursing. As the Bathinda AIIMS is starting, this is the first time they are going to recruit staff nurses. So we can expect more questions from these portions. Along with that, anatomy and physiology of female reproductive systems, fertilization, menstrual cycle, embryonic periods and fetal circulations, pelvic types, its diameters, and fetal skulls, and labor stages, complications, and nursing cares regarding this during the time of labor, and pre labor cases, and intra and post labor care, that is especially nursing care. Regarding the nursing care, they will ask more questions. We can expect 6 to 11% of weightage from these portions. Okay, and coming to pediatrics, we have growth and development and the reflexes of babies and immunization schedules, then behavioral problems of infants and health problems in the sense in each and every systems, especially integumentary, cardiac, respiratory, renal, and endocrine, every systems, hormonal, every system they are going to ask questions. And then burns and nursing care. In all the pediatric systems, you just expected question from this nursing care portions, and we can expect 4 to 8% of questions from this sub portion. And next one is we can see pharmacology. Pharmacology, previously it was not been asked. Nowadays the recently it has been changed that they may going to ask the route, the dose, and the rights of medications, and the equivalence of weightage, drug calculations. Drug calculation, we know that there are several formulas for adults and as well as pediatrics. So be care about these formulas and system wise specific selective drugs. For example, we can accept from cardiology system, there may be ventricular tachycardia as the drug of choice, and the antidotes. Every system we have specific drug of choice for each and every condition that should be specifically noticed. Along with that, antidotes. Coming to antidotes and medications, the nursing care regarding pharmacology, that is a main point which they are going to ask you, and we can expect around 5 to 8% of questions from this one. And other something like nursing education, nursing research, and nursing administration, microbiology, as well as pathology. This is the other subjects that recently it is being asked questions. So we can expect 5 to 9% of questions from this portion. So in total 100% they will cover all the nursing related subjects. Not even a single question from out of syllabus. So these are the syllabus which we are going to cover all the subjects. So out of 100 questions they are going to ask from these portions, the majority of the questions will be from these portions. Okay, so this is especially from Mantram Nursing Academy for a self preparation to face the exam. So how we are going to face the exam? On a day before itself we have to prepare to face the exam. So as well we were discussing about the preparation. Don't oversleep. Have everyone should concern about sleep. that we never sit on our textbooks later than 10 o'clock. So we should sleep at 10 p.m. and we have to wake up around 4 to 4:30. Between 4:30 we have to awake on the day before the exam. Okay, and we have to thoroughly go through whatever we have studied, and never forget about meals. They don't skip meals. We have to have energy to supply our brain, because whenever we are appearing for exam, our brain will works more. So whenever our brain is working, we consumes brain consumes more energy. As you know that you will be fatigued during the time of exams. So to avoid that fatigueness, you have to be very sure that you never skip the meal. Okay, and never get nervous. Okay, so if you are nervous, you can't even concentrate on any subjects. So whatever things you have learned or studied, that even you can't concentrate. So never get tensed. If you are being tensed or nervous, just follow Valsalva maneuver. As there is no need to explain you what is Valsalva maneuver, even though I'm giving you tips that if you are nervous, just close your eyes and take a deep breath and hold it for 2 3 4 seconds, and just relax and exhale the level through your mouth as a pursued lip breathing, deep and pursued lip breathing. That will be helpful for to overcome nervousness. And don't attempt anything new on the previous day, because if you are try to learn any new things which was not familiar for you during the time, so that will be meeting into a confused level, because at the time of exams you will be really confused with the knowledge which you had previously. And moreover, the basic of learning and understanding is rereading. So revise and reread. Never forget to revise and reread whichever things you have learned already. And on the day 29th of September, always keep in mind that be on time. Woke up early and take all the necessary items with you, like pen, admit cards, your identity card, and photographs. And keep an additional photographs with you. And one more thing is, during the time of exam, don't rush to answer. Even though you know the question and answer, just read thoroughly. All the questions should be read thoroughly. If you need, just read twice. And before going to answer, you have to go through all the options. Make sure that there are no better options. Okay, and as we said in the previous time, we have time of 100 minutes for answering 100 questions. So just if you can't answer a question in a minute or less than that, just keep it and plan it to come back later. In the sense, if you attending an easier question which you may take less than 10 or 15 seconds, or suppose it is less than 30 seconds, that will be fine. Otherwise, whenever you are going to attend, or you are spending more time on questions, each questions, that will lose you the for the last portions. In the sense, if you can't manage the time wisely, later with the anxiety or nervousness, you will definitely do mistakes during the time of last session in the exam. That is especially like last 20 minutes or last 25 minutes will be very crucial time for to answer more questions. You will be in a hectic time at the time of, if you are losing time in a single questions. And never lose stability. So always we know that the exam, those who are preparing exam or the questions, they will prepare a easy question, alternatively easy question and a tough question. For what purpose they are preparing such questions? Just to lose your stability. If you if you attend a easy question, and obviously you becomes, wow, it's a quite easy question and quite easy to answer, so I'll be easy to pass. And the next question will be very tough, so obviously you may become, oh, it's my bad. So that is a losing of stability, your stability. Whenever you loses your stability, you can't even concentrate, and definitely you are going to make mistakes. Okay, no, knowingly or unknowingly, you may do mistakes. So best of luck for all of you, and we hope that all of you are very interested with your tips, and all the very best for your exams and your success. Thank you.